this is, you're from Passages?
Passages.
Can you tell me a bit about it?
Sure. Passages is a agency that provides services for seniors, adults with disabilities, caregivers of people who have either brain impairment or some kind of a debilitating condition that is adult onset. So the services range anywhere from helping someone figure out how to keep their loved one safe at home, their elder loved one, to volunteer opportunities that we have many of them, specifically that support older adults.
Is it a local program? Or is
Yeah,
it
we are a project of Chico State Research Foundation, and but yet the different grants that we have that support all of the services are state and federal funds. We get funds from through the Older Americans Act, which was a federal act that provided funds for the states to provide supportive services such as senior nutrition, the lunch program that happens in senior centers, legal services, ombudsman program. Those are the advocates for people in nursing homes. And then there are other grants that we have also that support caregivers, and those come from the Department of Mental Health or also the federal government, depending on which caregiver program we have. And then the program that I have, for example, is funded by the federal and the state, and that's the Medicare counseling program called HICAP, Health Insurance Counseling and Advocacy Program. And most of the services are available anywhere in the country, depends on what agency obtained the grant. So for example, our Medicare counseling program, which is statewide also, my particular area of jurisdiction is 5 counties: Butte, Colusa, Glenn, Tehama, and Plumas County.
It's a big area.
Yes, it's a big area. But we have colleagues, I have colleagues all over the state that do the same thing. So every county in California is served by this Medicare counseling program called HICAP. But there's an equivalent program in every state in the union, and nationally it's called SHIP, State Health Insurance Assistance Program. And they're all funded by the Center for Medicare and Medicaid Services and local state funds.
So what is it exactly that you do then in regard to this? Is it
Well,
something that people have to sign up for?
To give you an example, let's say that you have an older parent and they live far away, and you're really concerned about, let's say that you live far away, or maybe even here, and your parents are starting to show some frailty. You want to make sure that they stay safe at home. So you'll call our agency, and we will give you some basic information of what to look out for, what may be modifications you need in the home, what kind of support services do you need to, for example, are you concerned about the title on the home? We could set up an appointment with legal services. Do you want to know a little bit more about how their health insurance is working? You as an adult child of an aging parent, or even they, if they're able to. We would set up an appointment with them or with you, evaluate their Medicare and their supplemental insurance and how their prescription drugs are covered and so forth. Then we would give you information about companies that offer various insurances that would supplement Medicare, for example, or how to save on prescription drugs, or how to reduce your overall your cost of medical care. Or maybe your parents just retired, they moved into this area and they want to volunteer. They've done all the traveling and now they would like to give back to the community. We have volunteer opportunities. The HICAP program, we train volunteers to be Medicare counselors. The Ombudsman program, we train volunteers to be advocates for people in nursing homes. Senior companions and foster grandparents, these are seniors that either are assigned to a school and help children, or they're seniors helping other seniors. And then we have community of caring, which they're all different opportunities that we have for volunteering. Caregiver support. Let's say that your mother or father is showing signs of dementia, or they were recently diagnosed with Alzheimer's. you as a caregiver would get support services from us, anywhere from legal services, support groups that you can go to talk about that responsibility, education on how, you've got to learn about the progression of the condition, respite. You're caring for them, it's a 24-hour, 7-day job, and so we would arrange for someone to come to your home and give you a break.
In your estimate, how many volunteers do you think are in the area that are seniors?
Well, in our program, we
In your
have close to
program.
200, maybe
Wow.
a little over 200 volunteers overall for all of the programs that specialize in assisting older adults, seniors, and some caregivers of younger disabled.
And how many years has the program been going?
Well, we are now, we've been in business as an agency since the 80s. And progressively, we've added more and more programs.
Very nice. I'm very, very glad to have you out here.
Thank you.